So let's talk how to get affordable health care for your family without going bankrupt. And that's literal, okay? I'm Quentin Moses. I'm an independent agent since 2006, so I've been doing this a while. That's my email, that's my phone number. Health Markets, we're the largest independent agency in the country. So why am I uniquely qualified to talk with you about this subject? Healthcare covers two disciplines, health and finance. So let's talk about my background in health. I graduated with a bachelor's degree from Rutgers University in biology. I attended the University of Medicine and Dentistry in New Jersey. I did all the preclinical work. And I grew a nutritional supplement business substantially in the 70s. Finance. I was account executive with Merrill Lynch in New York. I was vice president of investments with Lehman Brothers, right, Ron? And I was also senior vice president of investments with D.H. Blair, did a lot of biotech deals there, and a managing partner with AmeriCorp Securities. The 80-20 rule applies to a lot. So, in this case, we're talking about insurance. Now, 80% of the people in this country have group insurance. So that's what you get at work. I include Medicare there, and I include TRICARE there. When you hear the word group, what that means is someone's helping you pay for your health insurance, okay? You do not know the real cost of your group insurance until you go on COBRA, then you get religion, and you're like, oh, it's expensive. No, that was the cost of it, okay? That's 80%. Most of you never need this. What I'm focused on today is the 20%, which is individual insurance, okay? This is very confusing, and that's why I want to make sure you understand it and your friends and family understand it, because I thought Wall Street was bad. I've never seen anything like this today. There are only two forms, as you're about to find out, of qualified health plans, individual and group. Nothing else is qualified, okay? It's not. It's like Derek's saying, there's a big difference between a master plumber and someone who's not a master plumber. So let's talk about what's actually happening with health insurance. No one wants to pay for any insurance until they need it. So 80% of the folks in this room and 80% of the people in the country are perfectly healthy. They're perfectly healthy. Nothing's wrong with them. 20% are consuming 80% of the health care. So you don't know when you might be in the 20%. If you did, you wouldn't need insurance, but we don't. Now, right outside that 20% is another 20%, and they're about to go inside the 20%, which is why they need to know what's happening preventive-wise. You just never know. The biggest risk that we run in Atlanta is accidents. So you can go to the gym and work out with TJ, and you can take Protandim. Somebody smoking crack, riding around on 285, smacks into your truck. You need health insurance, okay? So that's what we're going to focus on. We're talking about a qualified individual plan. There is only one. There's only one place you can get a qualified health plan, okay? That's Obamacare or ACA, same thing, okay? So what does this mean? What does this mean? What this means is that with a qualified health plan, you have a cap out of pocket. In 2019, that's $7,900. If your bill is $1 billion, you're only going to owe $7,900. That's why it's qualified. Period. End of story. There's only 3 companies in the individual market that are selling qualified health plans in metropolitan Atlanta: Kaiser, Ambetter, and Blue Cross and Blue Shield. So no matter what you see on the internet, Cigna's not selling it, okay? United Healthcare's not selling it. When you see these names, they are not selling a qualified health plan. And they're selling other products, but they're not a qualified health plan. The agents on there have the agents I've talked to don't even realize they're not selling a qualified health plan, okay? So let's talk about a qualified health plan. So only 20% of the population needs this, but 100% have to get it because you don't know when you're going to be in that 20% circle. We're talking about a family of 4, 40-something with a couple of children. Blue Cross and Blue Shield, $3,000 deductible, $1,808.06. That's if you earn over $100,000 a year. If you earn $100,000 a year, you're going to get a subsidy by going to the exchange. I suggest going through me, so it'll take 10 minutes rather than 2 hours. But you'll get a subsidy because the price is still $1,800, but if you earn 100 grand, it's a little bit of a stretch. If you earn $65,000, your subsidy is going to be greater, so it's only $673. The price didn't change. It's still $1,808.06. You're just getting a subsidy to help pay for it. That's what your boss is doing at work with group, Steve talked about. Okay, this is important to understand. What's your worst case scenario? That's what Steve's talking about with that insurance. What's the worst thing can happen in your business? So, the worst case scenario by law with a qualified health plan is $15,000 for the whole family, even if the claim is $1 million or more, period. If you have group, you have individual, that's the law. They all fall under the same rules, okay? Let's talk about MediShare, because MediShare is an alternative, okay, but it's not health insurance, okay? So 80% could use this. Why? Because they're healthy, so why should they be paying all this money? The annual household portion is on $10,500, roughly equivalent to that silver plan, is only $334. What's your risk? It does not cover pre-existing conditions, and it limits maternity to $125,000, okay? If you have a pre-existing condition, you do not want this. If you're having a baby, you better be careful, because if you had $1 million bill, they're only going to cover $125,000. But if you're totally healthy, making 100, 200 grand a year, you could pay $334 rather than $1,800. Who are good referrals for me? Families who have household income greater than $100,000 per year who are healthy. We can have an intelligent conversation about alternatives, okay? Those are really, really good. Now, families who earn less than $60,000 per year and have pre-existing conditions. Those are good for me because I can show them how to maximize their subsidies, okay? No one on the exchange has a license, and the poor people on the exchange are dealing with 38 states, okay? Healthcare is different, or health insurance is different zip code by zip code. It is very confusing, okay? So I've gotten a number of people where they're paying nothing. They're paying zero, okay? They didn't know they could do it, okay? And trust me, so many places in Georgia only have one carrier. They don't have 3 like Atlanta, so it's confusing. So dealing with 38 states is more confusing, so get some help. So those are good. So what you're going to do, Jan's going to make a video of this. It'll be out in a couple of days. Put it on the internet. Thank you.